Another day, another video of first aid by COVID sweating without fever, causes, symptoms, and treatment options. First aid by the COVID-19 pandemic has changed the way we live our lives. One of the most common symptoms associated with the virus is fever, but there is also another symptom that can be just as concerning: sweating without fever. Sweating without fever is a sign that the body is fighting an infection and can be a symptom of COVID-19. In this video, we will discuss what sweating without fever looks like, what other symptoms may accompany it, and how to tell if you have it. We will also talk about how to manage it and when to seek medical attention. Sweating without fever is a common symptom that can be caused by a variety of factors, including COVID-19. Here is some information on the causes, symptoms, and treatment options for sweating without fever related to COVID-19. Causes. COVID-19 is a respiratory illness caused by the SARS-CoV-2 virus. Sweating without fever may be a symptom of COVID-19, especially in the early stages of the illness. Other causes of sweating without fever may include anxiety, stress, menopause, hyperthyroidism, certain medications, and certain infections. Symptoms. Symptoms of sweating without fever related to COVID-19 of May include profuse sweating. COVID sweating without fever is a symptom of COVID-19 that occurs in some patients. This type of sweating is often marked by profuse sweating. In some cases, it can be so intense that it causes a person to feel soaked in sweat, even when they are not exerting themselves. This symptom is usually accompanied by other signs of COVID-19 such as a dry cough, fever, fatigue, and loss of taste or smell. It is important to note that this symptom does not necessarily mean that the person has COVID-19, but it should be taken seriously and medical attention should be sought if it is experienced. Clammy skin. COVID sweating without fever is a common symptom of the virus and can be accompanied by a feeling of clammy skin. It is a symptom that can occur in both mild and severe cases of COVID-19 and is often accompanied by other symptoms such as chills, headaches, body aches, and fatigue. The sweat can also be accompanied by a feeling of general discomfort and may be more noticeable at night. It is important to note that although COVID sweating without fever can be a sign of the virus, it is not always a definitive indicator of infection. If you experience any of these symptoms, it is important to seek medical attention and get tested for COVID-19. Fatigue. COVID sweating without fever and fatigue is a common symptoms of COVID-19. It is a type of profuse sweating that occurs without a fever and is accompanied by fatigue. It can be one of the first signs of COVID-19 and is often seen in patients who are experiencing mild symptoms. Sweating without fever and fatigue can also be a sign of an infection, so it is important to seek medical attention immediately if you experience it. It is also important to take preventative measures to reduce your risk of infection and to continue to practice social distancing and wear a face covering even if you have no symptoms. Headache. COVID sweating without fever is a symptom of coronavirus, COVID-19, that many people experience. It is characterized by excessive sweating in certain areas of the body, such as the back and chest, and is often accompanied by a headache. This can be a very uncomfortable symptom, as it can cause a person to feel overheated, even if their body temperature is normal. In addition to sweating, a person experiencing COVID sweating without fever may also experience fatigue, body aches, and a headache. It is important to seek medical advice if you are experiencing this symptom, as it can be a sign of more serious health issues. Body aches and pains. COVID sweating without fever is a condition that can be experienced by some people with COVID-19. It is characterized by excessive sweating without a fever. Other symptoms may include body aches and pains, fatigue, and headache. It is important to note that this condition may be a sign of a more serious infection, and should be discussed with a doctor if it occurs. If you suspect you have COVID sweating without fever, it is important to take all the necessary precautions to protect yourself and those around you. Wear a face mask, practice social distancing, and stay home if you can. It is also important to seek medical advice if you have any of the symptoms associated with the condition. Cough. COVID sweating without fever is a symptom of COVID-19 that some people experience. It is characterized by excessive sweating without a fever, generally occurring at night or during physical activity. This type of sweating is not always associated with COVID-19 and can be a sign of other medical conditions. It is important to note that other symptoms, such as coughing and difficulty breathing, should also be taken into consideration as they can be signs of a more serious infection. If you experience excessive sweating without a fever and are also exhibiting other COVID-19 symptoms, it is important to seek medical attention as soon as possible. Sore throat. COVID sweating without fever is a symptom of the novel coronavirus and is characterized by an increase in sweating without any accompanying fever. This symptom is often accompanied by other symptoms such as a sore throat, dry cough, fatigue, and loss of taste or smell. In some cases, people with COVID sweating without fever may experience body aches, headaches, and nausea. It is important to seek medical attention if you experience COVID sweating without fever, especially if it is accompanied by other symptoms. Shortness of breath. COVID sweating without fever is a symptom of the novel coronavirus that has been reported in some cases. It is characterized by excessive sweating without any accompanying fever. Other symptoms associated with COVID sweating without fever may include fatigue, dizziness, and shortness of breath. Shortness of breath is a common symptom of COVID-19 and can range from mild to severe. It is important to seek medical help if you experience any of these symptoms, as they may be an indication of a more serious health issue. Loss of smell or taste. COVID sweating without fever is a symptom of the COVID-19 virus that can occur in some cases. This symptom is characterized by excessive sweating without an accompanying fever, which is an important indicator of illness for many illnesses. Additionally, COVID-19 can also cause a loss of smell or taste, which can be a symptom of other illnesses, such as the common cold. It is important to contact a doctor if you are experiencing any of these symptoms and follow their instructions for treatment and precautionary measures. Treatment. If you are experiencing sweating without fever related to COVID-19, it is important to get tested for the virus and follow the guidance of your healthcare provider. Treatment options may include rest and hydration, over-the-counter pain relievers for fever and body aches, prescription medications for more severe symptoms, oxygen therapy or hospitalization for severe cases. In addition to medical treatment, it is important to take steps to prevent the spread of COVID-19, such as wearing a mask, practicing social distancing, washing your hands frequently, and avoiding large gatherings. If you are experiencing sweating without fever, it is important to talk to your healthcare provider to determine the underlying cause and the most appropriate treatment options. Conclusion. In conclusion, it is important to remember that COVID-19 sweating without fever is a symptom that can occur in some people infected with the virus. While it is not a common symptom, it is important to be aware of it so that people can seek medical attention if they experience it. While the underlying cause of this symptom is still unknown, it is important to remember that it is possible to experience COVID-19 sweating without fever and that it is important to seek medical attention if this symptom occurs. Thanks for watching.